AIRVO system provides humidified high-flow therapy, using the AIRVO humidifier itself with a built-in flow generator producing flows from 15 to 45 litres per minute. An oxygen delivery system which can raise the fraction of oxygen delivered up to 60%. A water chamber where the breathing gases are warmed and humidified. A breathing tube heated to minimize condensation. And a patient interface to complete the system. Let's take a closer look at how it works. A quiet motor inside the unit draws air through a filter into the back of the AIRVO. This built-in flow generator means a separate air supply is not needed. The flow generator pushes air into the water chamber. A float in the chamber maintains the water level at a fixed height. The water is warmed by the heater plate, creating a high concentration of water vapor in the headspace. As air flows through the chamber and collects this water vapor, it is warmed and humidified to body temperature and humidity. The air leaving the chamber is regulated to a dew point temperature of 37 degrees Celsius, the optimum for humidification therapy. The AIRVO is a heated pass-over humidifier, so water in the humidified air inside the chamber is a vapor. If we could magnify this headspace 10 million times, we would see that the vapor is a gas of individual water molecules, each more than 100,000 times smaller than a human hair. Viruses are much larger than water molecules. Here is a flu virus for comparison. Water molecules are so small, in fact, that as a vapor, they cannot transport bacteria or viruses. Nebulizers, however, another method for humidification, produce water droplets. Each droplet is many times larger than a virus or bacterium. The same flu virus is tiny when compared to a water droplet. These water droplets can easily carry a variety of bacteria and viruses along with the respiratory gases. So, by using water vapor for humidification, the AIRVO substantially reduces the risk of infection. This water vapor from the headspace in the water chamber enters the breathing tube through the port on top of the AIRVO. A heated wire inside the tube warms the humidified air to prevent condensation and to maintain the air temperature and water vapor content all the way to the patient. A sensor integrated at the end of the breathing tube allows precise control of the temperature and humidity of the respiratory gas supplied. No external probes or sensors are required. The respiratory gas is delivered to the patient using a comfortable patient interface, such as the OptiFlow nasal cannula shown here. The patient interface is an important part of effective treatment. The OptiFlow interface allows the patient to eat, drink, and talk during therapy. This gives better patient compliance, which both improves treatment efficacy and reduces clinician workload. The AIRVO can also be used with our Direct Connect tracheostomy interfaces and using our mask interface adapter with tracheostomy mask interfaces. So far we have seen how the AIRVO conditions the respiratory gas for the patient by drawing room air into the back of the unit, warming and humidifying this air with a pass-over humidifier to minimize the risk of infection, using a heated breathing tube to reduce condensation, and using a comfortable patient interface for better patient compliance. Conditioning the respiratory gas is only the first part of the story, however. Now, let's examine how this humidified gas benefits the patient. We will cover accurate oxygen delivery, clearance of anatomical dead space, positive airway pressure, and improved mucus clearance. During inspiration, the AIRVO delivers all the respiratory gas required by the patient. In contrast, a conventional cannula typically supplies only a small fraction of the patient's peak inspiratory demand. The balance is drawn from room air, diluting the oxygen supplied by the cannula. By using a flow rate that aims to meet or exceed peak inspiratory demand, the AIRVO provides accurate oxygen delivery irrespective of the patient's breathing pattern. The high flow delivered to the nares clears residual carbon dioxide from the upper airways at the end of expiration. This reduces rebreathing of carbon dioxide and is particularly important for hypercapnic patients with diminished tidal volume. The high flow of the OptiFlow nasal cannula also creates a positive pressure in the airway, particularly during exhalation. This positive end expiratory pressure, or PEEP, helps promote slower, deeper breathing. By warming and humidifying the respiratory gas to body conditions, the AIRVO both prevents the high flow gas from drying the respiratory tract, which can be uncomfortable to the patient, and hydrates the mucus lining the conducting airways. We've studied this mucus layer in animal models using high magnification video microscopy. This clip shows tracheal tissue covered by a mucus layer. This layer traps inhaled particles such as dust and bacteria. Unless the mucus is cleared, these foreign particles will accumulate, increasing the risk of infection and decreasing lung function. Temperature and humidity play an important role in mucus clearance. Observe how the debris stop moving when exposed to cool, dry room air. Conditioning the air to body temperature and humidity restores effective mucociliary clearance, reducing the risk of infection. Our DVD on mucociliary transport video microscopy contains a lot more information on the effect of temperature and humidity on mucociliary clearance. Contact your local Fisher & Paykel healthcare office if you'd like a copy. The AIRVO, together with our OptiFlow range of nasal and tracheostomy patient interfaces, provides an effective, versatile and easy-to-use system for delivering high-flow therapy. It will ease breathing, reduce the risk of infection, and improve mucus clearance in patients suffering from a wide variety of respiratory conditions.